My name is Greg Schendel. I'm an architect and project manager for a local construction company here in Duluth. What are we doing here? We are doing an interview about my upcoming knee surgery. About a year, maybe a little bit over a year ago, I noticed I had injured my knee. I don't know specifically what I did, and it just has never been the same. So it's a constant wearing pain on my knee. We live in the country in Lakewood Township. We have 20 acres, and my activity is being outside. Absolutely. I think I absolutely ask myself all the time, what am I not doing because of my knee pain? After the surgery, I just want my activity level to be as it was before, whether I'm walking up and down a riverbank or whether I'm working in the garden or in my apple orchard. I don't want the constant pain, chronic pain. So I made the decision. I called Joe directly.
I'm Joe Signorelli. I'm an orthopedic surgeon here at Memorial Medical Center.
We made an appointment a couple weeks later and went down, and we made the decision to proceed with partial knee replacement.
I think Greg initially thought that he was probably in for a total knee replacement and was pleasantly surprised to find out that both he was a candidate for a partial knee replacement, and it's something that we offer here at Memorial Medical Center.
Having surgery is not a big deal to me. I'm more trepidatious about the recovery because they say I won't be able to drive for 2 weeks, which will be difficult. Joe actually called me yesterday and talked to me for 15-20 minutes asking if I had any concerns or thoughts about what was going on. We had a long discussion about how the day would go. He believes that I'll be able to go home the same day if everything goes as planned. So that's what we're planning on right now. Day went good. It was an early day. I had to be there at 7, so we left here at 5.
If you want to have a seat in the lounge, I'll give them a call and let them know you're here. Thank you. You're welcome.
Just went in and sat down in the waiting room, and they checked me in right there.
So I'm James. I'll be the nurse getting you ready this morning.
All right.
So before we head back, have you had any coughs or fevers recently?
The registration was very, very easy. They just asked me a couple questions right in the lobby. And then when it was time, we moved into the pre-op room.
And we'll be right back. You can have a seat in the chair, and I'll get an extra seat out for you.
Did we sleep well last night?
It probably took about 45 minutes to go through everything there.
The next step here, I'm going to have you change into the gown. Is it all right if I come in? Sure. All right.
Because Joe's really sticky on cleanliness, there's wipes you have to take. They gave me all of that, and then it was just a matter of waiting for surgery time. So.
Hey, Joe.
Good morning.
Hey, Joe.
Hey, how are you doing?
Good. How are you doing?
Good.
Good.
Pills for breakfast.
They go down all right?
All down?
All right.
You're large.
Yes. How are you doing today?
Doing good. Tired.
Yeah, early morning. Any changes in health history, medications, allergies since last time we talked?
No.
Okay. We're doing right side today. Do you agree with that?
I do.
I'll put a mark on the inside part of the right knee. Good. All right, so surgery itself's about an hour and 15 minutes, an hour and a half. Are you going to be out in the waiting room afterwards?
Yep.
Okay. So I'll come chat with you afterwards, and then you'll be in the recovery room for about an hour.
You know how it goes?
Yep. Any other questions?
No. Not that I have.
All right. We'll see you back there soon. We'll see you right afterwards.
Sounds good. Thank you.
Okay. All right.
Good morning.
Hey, you're Carlos.
I'm Carlos Schendel, the anesthesia.
Hi, Carlos.
Hi. So, as far as anesthesia, we normally do this with spinal spinal anesthesia. It'll numb you from your waist down for a couple hours. And it'll still keep you asleep through the surgery.
Okay.
Most people don't remember anything.
All right.
All right? You okay with that?
I am good.
Okay. I'll see you soon.
All right.
Thank you.
You're welcome.
Pretty soon.
Good morning. So I'm just going to scan you here, sir. And I have a nice warm blanket for you, sir. And we'll get our hugs and kisses and see you laters, okay? We're going to take off here pretty quick. And off we go, and they let you know where to stay? Okay. Great.
Right out here in the waiting room.
Excellent.
Thank you very much. Right back.
I see you're from the Duluth area. Nice of you to come with us. Very good.
I remember getting wheeled into the operating room, and I remember the camera being there, and the last thing I remember is because I was having a spinal, I was sitting on the side of the table. I wasn't laying down, and that's the last thing I remember.
So Greg ended up being a fantastic candidate for a partial knee replacement. We have the advantage here at Memorial Medical Center to use CORI, which is a robotic platform for doing knee replacement. We've, I think, done between 400 and 500 knee replacements using robotic assistance. The system allows us to go in, we do a 3D mapping of his actual knee. And so that goes into the system. Then we can do a simulated knee replacement where we can change all of the size of the components, the type of component that we're going to put in. We can change the position of the components in 0.5 millimeter increment and 0.5 degree. It gives us a level of input and information that we never had before.
I'm Anita Schendel, and I'm Greg Schendel's wife. And we've been married since 1985, 35 years. To see him in pain breaks my heart. So I would love to see the surgery be successful and him be out with me after 35 years. It would be wonderful. This is my patient tracking system card. Greg just went into the OR, and on the TV screen in the waiting room, it showed me by his patient number up here that he is currently in the OR. So while he is being operated on, I am going to go for a short walk. And then I'll come back and check the TV screen to see if he's in recovery or if he's been even preparing to go home.
Everything went really well. No issues at all. He did great with surgery, great with anesthesia, no problems there. So they're putting the final dressings on now. He'll head out to the recovery room. He'll be there for about an hour or so, and then he'll make it up to his room.
Okay.
Once he's up there again, he'll have physical therapy, occupational therapy, meet with the social workers. I'll come talk to him and talk about what to really think about through the different phases of care. So we want to really give him clear instructions on what to do for the first 2 weeks. And then he'll come back to clinic, and then we'll talk about what to do between 2 weeks and 6 weeks. And then at 6 weeks, we'll talk about how to go on from there.
Okay.
Okay?
So excited. I cannot wait for him to be back walking and biking and even snowmobiling. That was
Right. I think once he gets through the early recovery from this, he'll be doing a whole lot better.
good news. Thank
Good news.
you. Thank
All
you.
right. Have a good morning. We'll see you this
All
afternoon.
right, we'll see you later. That's good news. Yay. Yay, thumbs up. Yeah, we can just get back to normal. That's the normal activities. Normal activities. Yeah.
15.
I'm gonna have this arm, I'm gonna have you straighten it out for that when we get a blood pressure. This part's kind of boring because you're awake and you're feeling good, so we just have to monitor your heart and your oxygen level, and then as soon as you're good, we'll bring you upstairs.
There we go. We'll see where your spinal's at again here. Okay, we'll feel me touching on the side.
Yes.
All right.
Yes.
You look great. You did excellent, Greg.
Good. Thank you.
You're welcome.
Alrighty. So this is our inpatient unit. Hi,
You
Linda.
must be Gregory.
That's me.
Hi, Gregory. I'm Linda, and I'm here with you till 3:30.
There you go. Cool.
This is Gregory. Dr. Signorelli did a uni on him today.
Big deep breath. And out. All right, here is your menu. This is the number you're going to call. So yeah, order whenever you're ready. Hey, how are you?
Hello, I'm fine. How are you?
Good. My name is Linda, and I'm here. I'll be here till about 3:30.
Wonderful.
Okay.
I can feel it now, so.
Can you feel the pain?
I wouldn't call it pain, I just feel that something happened there.
Yeah. Happy it's done?
Yeah, I don't remember the last 3 hours. 2 hours. 2.5 hours.
Greg spent a little time up on the inpatient floor. He worked with physical therapy, occupational therapy, and should be going home pretty quick here.
Discharge was very, very simple. Once I felt good enough, it went relatively fast.
Wait, right out here for her to pull up.
I think there's a perception that since Greg can come in the morning, have surgery, and go home that afternoon, it's now a minor surgery. Whenever we're taking part of a joint out or a total joint out and putting a new joint in with artificial material, it's still a major surgery. So there's a significant recovery process that's involved. There's kind of the short-term recovery in terms of getting rid of the swelling, getting rid of the pain, and then a longer-term recovery in terms of getting your range of motion back, getting your strength back, and returning to everyday activities. So in the short term, Greg basically has to sit back and take it easy for a while, which is a lot harder than it sounds for most patients. People are eager to have surgery because they want to get back to their busy and active lifestyle. So a lot of what we do early on is actually pulling back on the reins a little bit and making sure that we set Greg up with a good healing environment where it's easy for him to take it easy and not push the knee too far.
My next step that I'm 1 week after, just over a week after surgery. Good morning. I think it went really good. We were, and Anita and I talked about it a lot, is we were extremely happy with the hospital staff, and Joel. I feel good. I get a little bit less pain every day and more movement every day. My exercises that I have to do 2 or 3 times a day, which are basically all stretching exercises, basically. I don't have the internal knee pain. I feel pretty comfortable. I mean, right now is if I'm up and moving around, it feels pretty normal. I don't have any pain in my knee. I hope to lose my walker after this week. Getting to the point now that I have to remind myself all the time to use the walker. Basically, they drilled in my head that for the first 2 weeks, every step that I take is with a walker. They made that 100% clear. So I don't know if this is the approved, appropriate way of doing it, but this is how I do it. I know it's going to be better, and I know it's going to be better than it was before. It's just how long and how diligent am I going to be at getting it there? Because without a doubt, everybody says, do your exercises, go to PT, and your recovery will be twice as fast if you do what you're supposed to do. And I talked to a really good friend of mine last night that had a full knee replacement by Joe about 8 months ago. And what he said exactly, you're in the time right now where you're asking yourself, when and is this thing ever going to be 100%? And he said, give it Give it a few weeks, give it a month, and you're going to be nothing but happy about what you've done and the decision you made. Because you won't know, a month from now, you basically won't know that you had the surgery.